Wisconsin and really the entire north part of the country is under this kind of accelerated case spread, because that part, if you just track where that Arctic blast came in October and people moved indoors and took their mask off, you can see how those become spreading events. They become spreading events whether you're in a bar, they become a spreading event whether you're in your home with individuals outside of your household. And so now that we know that we have created these spreading events and spreading occurred, we know exactly how to stop it. And so we know, and we have the ask that everyone changes their behavior in this moment as we bridge to making vaccines available to the people of Wisconsin that really need the vaccine. And so really asking people once more to really take the precautions that they know result in viral spread. And I think what we do know is how common asymptomatic spread is, where it's no one's fault. They don't know they're infected. I know it's difficult to comprehend that there's a virus out there that can cause no symptoms in some, and hospitalizations and deaths in others, and long-term consequences in others. And so that's difficult for people to understand, but we know now that that happens. And so really asking everyone to not be in any public space without a mask on, and to not have people outside of their immediate household into their household for any kind of gatherings, or to go to anyone else's house for a gathering. That's how we can flatten this curve. And what's encouraging to me is the United Kingdom has already been able to start to flatten their curve. So even though this fall surge is more rapid, resulting in more hospitalizations, we already have countries that are successful in flattening the curve because they put in a mask mandate. They told you not to gather and take your mask off, and they closed bars and restaurants.
Right.
I think two things. One, we are in constant communication with state and local officials, and I think that's really important. It's part of the reason why I've been on the road for over 4 months, really being in 42 states, meeting with local mayors, local county commissioners, communities, tribal nations, governors, and their entire health staff. And I can tell you, everybody is pulling in the same direction. But we need all of America and every single citizen of this great country, as the entire country cools, to be doing exactly the same thing. Wearing masks, not taking our mask off in any public space, and not having gatherings or going to gatherings in other people's houses or in our own houses. We know how to stop this spread. It's a short time period that we're asking people to do it for. And so we know now what happens when the Northern Hemisphere cools. You can see it in Europe, you can see it in the United States, you can see it starting in Canada. And together we know exactly what needs to be done. We just all need to do it together. Through their data right now. And if I could say anything to Pfizer, I would say submit it tomorrow. The FDA is ready to receive your package and review that data. Because every day, obviously, you can see the case number, you can see the hospitalizations, you can see the rising fatality. Days matter now. So the sooner that package of information can get to the FDA, the faster they can review it. We've already heard from the Independent Data Safety Monitoring Board that this vaccine is highly efficacious, greater than 90%. We couldn't ask for more, really, and safe. So we know that. Now we need the company to refer that to the FDA. We need to get that approved so we can start bringing vaccine to states. I really want to thank all the states like the great state of Wisconsin, who submitted their vaccine plan several weeks ago. And so the planning has been done. The distribution has been arranged. The alcohol wipes, the needles and syringes have been procured. And now it's a matter of getting it approved by the FDA, but it requires the company to submit. And I know that's going to be happening also, hopefully, with Moderna. That's what they have signaled. And once we have those two vaccine products, what's important for America to know is, once you know precisely, now remember, these were vaccine products to generate an immune response to what we call the spike protein. That's the protein that allows that virus to get in your cells, take over your cells' machinery, and churn out more virus. And so that's how that vaccine works. The other candidates that are coming along are directed exactly the same way to that same protein. And so once you start to get efficacious vaccines, then you can do what we call correlates of protection bridging studies. So you don't have to enroll another 75 or 30,000 people. You can actually show that the new vaccines generate the same immune response that the first vaccines did that were shown to be efficacious. And so we should be able to move through more vaccine candidates and make more and more available to the American people. And that's why I think just in this moment of time, together we can flatten that curve. We're only asking people for the next 4 to 6 to 8 weeks to work together to wear their mask and not to put themselves in situations where their mask is off and there's other people in the room. Pfizer and other manufacturers have created these vaccine boxes that protect the vaccine. But people should know that we've had to have this kind of cold storage and resource limited settings around the world. Of course, I came out of the vaccine field. I've collected what we call lymphocytes or T cells around the world. They have to be shipped in these kind of containers back from Africa to the United States in order to be studied. So this is something we know how to do. It's something we have done now for decades. Certainly I have done those shippers and containers around the globe. And I think we should be confident that we know how to do that and how to get these vaccines to the people who need it the most. I think there's two pieces to vaccination that we both have to understand clearly. First, there's vaccinating the people who might be most exposed, the healthcare workers, our frontline providers, but also we know precisely with this virus who's the most vulnerable. People over 70, people with comorbidities. And we know precisely how many Americans those are. It's about 80 million. So when you do the healthcare providers and our vulnerable Americans, that's about 100 million. That's what we need to be focused on right now, because that's what protects the most individuals from hospitalizations and fatalities. And then we will develop, while immunizing the rest of us, herd immunity as a country, herd immunity through vaccination. And that's the way you achieve herd immunity. You vaccinate individuals, and then the whole of America will be able to protect all of us by having that type of herd immunity. But I think the tiering of who gets vaccine first is really critical, because we want to make sure that we both are protecting those most exposed and protecting those who need it the most. Obviously, I know Vice President Biden, now President-elect, from, obviously I came in during the Obama administration, but I've been in every administration since February 1980 when I came into service in the military. So did 29 years there, then went to HHS CDC, and then went to State Department by President Obama, Vice President Biden, and now I'm here detailed helping in the White House. I have been privileged to be a public servant. I obviously will stay being a public servant if I am needed. I'm sure it's sometime they will contact us. We have not been contacted.
Okay.